Hey, ladies, how's everyone doing tonight? Hope you're all having a great day so far. This Wednesday, welcome to Wellness Wednesday, and a special welcome to our new ladies in the group. If this is your first Wellness Wednesday, I think you're in for a treat. Um, Before I get started, though, I believe everybody can hear me and see me okay. Think we're good. I will say my disclaimer while we're waiting for any more to join who want to. So. Anything that I say tonight during this Wellness Wednesday is just health information and is not health advice. Please don't start or stop taking or change the way you're taking any of your medications. If you feel like you need to, please first consult with your prescribing practitioner so that they can help you make the appropriate adjustments safely. And attending this Wellness Wednesday does not establish a doctor-patient relationship. So there you have it. Are we good to go? I think, okay, I think we're good. And it's such a pleasure to be with you again tonight. This Wellness Wednesday, look, we're going to do what I really love to do. All right. And that is we're going to put on our detective cap, right? And go through a case study. And I know going through these has always been so eye-opening in the master classes I give. And a word about that, I am super pumped about the masterclass. Just a few days away now, right? Starts Monday at 7 p.m. Mountain Time, 6 Pacific, 8 Central, and 9 Eastern for you East Coast ladies. And it goes through Friday, every night, Monday through Friday at the same time, always. So, and I generally always have so much information to share that I usually drop bonus sessions where I give you so much more to chew on, right? With just such great information through the weekend. So I'm looking forward to sharing this with you. Now, I know you all get emails and text reminders that we send you, so you really shouldn't forget about it, especially if it's important to you to find out why you're so tired and fatigued, why you're stuck with the weight still, and or maybe you lose it for a while and it all comes back on. And so there you go. Now, the master class takes place right here in this group, just like we're doing tonight for this Wellness Wednesday. We'll be posting a link for the workbook when it's ready to release as well. So be looking for that so you can have it handy. I believe it's going to also be pinned in the featured section. It usually is. You will get much more out of the class as well if you attend live. That way, you can participate and comment and ask questions. Also, you're with all these other ladies who are dealing with similar issues like weight gain and fatigue and brain fog and all of this. So, in other words, you're with like-minded women who are looking for answers and who are really, hoping for a better and healthier life without the excess weight and without the fatigue, and you'll attend with others who have taken the class before. Even patients, some patients who've had real successes, you can learn from their insights, learn, from what they share as well. Right, ladies? I mean, those of you who have been there, this is an amazing group too, and the live interaction and support is the best. Yeah, I'm so excited. I cannot wait. I love sharing and teaching this information. And this is going to be a big master class in our Fix Your Thyroid, Change Your Life group. So I'm looking forward to be able to spend my evenings with you all next week, ladies. So put Monday on your calendar, Tuesday, every day through Friday, right? Make sure you can be where you know you can be focused, with your workbooks and notebooks and whatever, so you can really take it all in, learn what you need to implement, and start seeing changes finally. Oh, and for those of you who put yourself first and show up for yourselves for session one, you'll get a free copy of my Thanksgiving recipe guide for women with thyroid dysfunction. It's full of great recipes to make a complete, healthy, delicious Thanksgiving meal that will support all of the healing steps that I will be teaching you during the masterclass. So everyone who shows up for session one will get a free copy. So plan ahead and and be there. This way, you can certainly plan ahead for your Thanksgiving and have success with this upcoming holiday season. All right. I'll have other giveaways as well during the other sessions we always do. So stay tuned for those. Tonight, I'm going to go through a case study. Now, first, you have to have an understanding, especially about what I am looking for when I review these tests that we do. Some of you have been in this group have this background. Some of you have already gone through the testing, have heard how I do it. But those of you who are new to the group really do need to have this background and to be able to understand why I'm going through these tests the way that I do it. Why I'm looking at the markers with different ranges. And that's simply because different labs have different ranges. It's all based on statistics. And so each lab gathers the data, that they get, and it can vary from lab to lab and coast to coast. I mean, literally. All right. And now something you've also probably heard me say a lot is that you still have the power to heal, right? Your body is born to heal, and it's a self-healing organism. It's made this way. Now, many of you say, however, yeah, but I've been feeling this way for so long, for years and decades even. And it's like you're giving up hope a little or losing faith. Losing that intuition that you still have the power to heal. But your body does have the power to heal. And you have to know that there are, imbalances, there are malnourishment, there's poor nutrition. Your body gives you symptoms so that you know that something isn't right. Now, this is how it communicates that something is wrong inside. And I know so many of you have been brushed off from time to time by your healthcare practitioners. You've gone to your doctors with symptoms and they say, that's just your age. And get used to it. You're a mom. Or, of course, that's going to happen. Or, of course, you feel like that. You're in menopause. You're tired. You can't lose weight. You have mood swings. Of course, you do. You have low thyroid. You're always going to have that. So that's when you get, what you get told over and over again. And so you start to lose that hope and understanding that your bodies can actually heal, right? You start to feel like something is wrong with you, mentally. You start to feel like nobody understands what you're dealing with. But you have to remember, because you already knew that your body can heal. But if we give in and ignore the symptoms your body gives you, or you're just going to keep pushing them away and they're not addressed, they turn into diseases over time. And so the way that I approach patients or any person who has symptoms or a disease process is to ask the question, why? What is causing it? Where is it coming from? Right? What's keeping this person from getting better? And we have to go really deep sometimes to get to the root causes of why someone has a symptom or a disease process. And I know that it's kind of like a novel idea, but we think, well, isn't that how traditional medicine works? And it actually really isn't. Okay. In traditional medicine, it's just about treating the symptoms or the disease, right? It's a disease and drug therapy model. So it's always about, let's find the name of the disease. And when we have the name of the disease, many times it doesn't even tell us what the disease really is. It's just a creative name for like a symptom or even a group of symptoms. For example, arthritis. It's a name for a collection of a few symptoms, including joint pain, joint swelling, sometimes joint deformities, inflammation, or signs like rubor or redness. Like I said, you can actually see nodules sometimes, but they just group these symptoms together and give it a name, arthritis, right? So this begs the question, why do you have arthritis? What do you need to do to get rid of this arthritis? And what's causing it? So the name doesn't tell us any of those things. Now, the traditional approach to arthritis may be pain medications like anti-inflammatory pills or creams, pain relievers, right? Immune modulators or biologics in the case that it's, considered maybe autoimmune. Even antibiotics sometimes, and medicines like methotrexate or nerve modulators like gabapentin. Rarely do practitioners recommend lifestyle and self-care like yoga or, you know, stretching. Maybe they say to go walk, but how many times do they actually tell you to change your diet when you have arthritis? One second. And but if you approach this from a drug therapy model, okay, you have the name of the disease, which equals this or that medication. And everybody that has this disease pretty much gets the same medication or treatment. It was a big joke in military medicine that, we were prescribing vitamin M, Motrin, right? For all these pains. Um, and these medications are not intended, nor are they able to reverse a disease process. And please remember that. They're mainly intended to reduce or cover up the symptoms. It's not addressing the true root cause by any stretch. And that's where we get into trouble because when you don't address the underlying root cause, which, you know, honestly, gets bigger and bigger and it grows into actual disease, it may be unrelated to the arthritis, like heart or kidney or liver disease or even cancers. So for me, I got to say, all right, why do you have these symptoms and what's the underlying imbalance? What do we need to do to address, and reverse these issues? And when you approach it like that, then most of the time the body can heal and the symptoms just go away. And your body's voice, starts quietly, then it gets a little louder and a little louder until it starts screaming at you, like, hey, Nancy, or hey, Lisa, you got to figure this out because I'm tired and can't function fully and I'm not happy. Neither are you. So you have to keep, asking the question, why do you have these symptoms? Why do you have these disease processes? And really understand what it is that we need to do to solve the problem, you know, uh, and gently push the body toward healing itself, right? Okay. The body can heal itself, and you still have the power to heal, but sometimes it just needs help. Sometimes the environment is that it is in is or the various traditions you live by are not conducive to healing, and so it cannot heal. So you have to recognize some of these and really understand what is going on underneath the surface and what is the real path forward, the correct path, right? So tonight, I'm going to go over just the typical blood work and saliva that I do whenever I'm evaluating whether I can accept someone as a patient. Now, we do other tests that also help our clinical team to understand more, but we don't have time to go through all of those tonight. But we're going to go through these, and I want you to think about a couple of things. Number one, have you had all these tests? Number two, do you have symptoms? Okay, and we've got to dig deep to figure out where these symptoms are really coming from. And I want you to understand that if you have symptoms or you have a disease process that you've been struggling with for many years, and you haven't had these tests done and you haven't had them analyzed from a functional medicine perspective, then there is still hope for you. Okay? So many of us start to lose this hope because you go from doctor to doctor expecting a different result from going to the same type of doctor. But all of these doctors have the same tool in their toolboxes and they have all the same medication that's supposed to help you. And when it doesn't, as so often is the case, you've got to look for a different solution. And when you look for a different solution, you decide to go down a different path. Then you can get different information and you can expect different results, right? All right. So let's get to these labs. And let's see. I'm going to pull this up first. And I'm going to give you some background. Gonna blow this up a little bit for us because I know that's too small. Hold on. Okay. And like I said, just a little bit of background. Uh, this lady, she is 63. Um, Wanted to bring up my notes so I didn't forget anything about her. And um, all right. So she is 63. Um, she's on several medications. All right. And this is kind of how she describes her symptoms. She says that she can't sleep very well. She was having real problems with getting to sleep and staying asleep. She has no motivation. Uh, she she was she's retired and kind of had to retire early because it was so difficult for her to stay on track with her focus. She was overweight and frustrated that, because she doesn't eat a lot of garbage, she said, she was still struggling and she felt overwhelmed by everything. Like the house is messy and she can't focus on getting things done. And there's just so much that needs to be cleaned up and if she's touched, if her husband just brushes her arm, it's so sensitive. She says if cats walk on her leg, that she has these cats, then it feels like an elephant is walking on her. So her muscles are super sensitive, so all these things. And so let's let's consider, oh, and just one other thing about her that I wanted to mention. Um, So she also said that she mentioned all the medications she's taking, and she's on some antidepressants. She's on thyroid medicine, right? She's also on a statin, and she's on blood pressure pills, and then she's trying this phentermine, which is an appetite suppressant, right? Because she's really sick of her weight. Okay, so she's on some medicine for glaucoma, some drops, right? And then some medicine for anxiety. All right. So she's on all this stuff and she really hates being on all this medication. All right. So uh, let's let's show you her tests here. And we're just going to go from the top. She has really high ferritin and sort of low iron. This should be at least 85, 90 with the iron. An increased ferritin means that she has infection. All right. So I actually do want to actually jump down here and show you that her underlying issue is this autoimmunity and Hashimoto's. All right. So here are her antibodies. So this is really the center of her storm, if you will, her health storm. So she's got both antibodies present, right? She's got these thyroid peroxidase antibodies that are present. They should be zero. And then she's got all these thyroglobulin antibodies. And I'll just say this once. When you have these types of antibodies, your thyroid numbers are never going to be the same every time you get them treated. And so she was complaining about having her thyroid medication really all that it was always being adjusted. It was always being changed. And this is what happens with Hashimoto's. So the other issue was she has a blood sugar problem. Now, this 5.6 for this A1C isn't in the optimal, it is above the optimal range, which is really between 5.1 and 5.4 is where I really want it. This is the average blood sugar she's got over 3 months. Okay, so she's a bit above that. Let's jump back up here to her chemistry, and we'll see that she has a glucose of 97. So her doctor is never going to look at these numbers and tell her she has a blood sugar problem, but she does. All right. And I'll point out some of the other blood sugar dysglycemia markers as I go through this. But let's kind of go back up and and keep going from where we were at. Now that you have like this context that we were building, she has this autoimmunity and she has triggers that cause her immune system to attack because this is not a thyroid problem. This is an autoimmune issue. Hashimoto's is an autoimmune problem. Okay. So we see that she has actually sort of elevated red blood cells. These should not be above about 4.5, and they're just above that. Hemoglobin, a bit high too. Hematocrit. This is a pattern for heavy metal toxicity. All right. Her MCV is high too. This indicates that she does not activate her B vitamins, especially folic acid and B12. So she's got really big red blood cells. And so this can cause cold extremities. She didn't necessarily say she had any of that, but she does have temperature issues, temperature regulation issues. She said she was dealing with some of that. So big red blood cells is almost always going to relate to poor circulation because they're just too big to get to through the tiny capillaries in our extremities. Okay. Now, let's look at some of the infection patterns that we see. So she's got monocytes that are over 5 or 6%. So this means she has an active infection process somewhere. And then she has eosinophils. These are the parasite fighters. Anytime I see these at 4% or higher, there's a significant parasite issue. It doesn't mean that if it's lower, she doesn't, but this is a significant parasite issue. All right. Parasites steal nutrients and they feed off our glucose and proteins, amino acids. So we can get cravings just because of having parasites. All right. Now she has, looking further down at her, we're going to look at her electrolytes, and I'm going to point something out here. I'm going to do a little math, and so I hope you can follow me. This 141 and this 4.8, we add those together, 145.8. And then we add these two together, 102 and 24. So that's 126. Let's subtract 126 from 145.8, and we get 19.8. So this means her anion gap is 19.8, and it should not be more than 12. I do this calculation because this tells me if she has adrenal dysfunction or not. And she truly does. Adrenals, those little glands that sit on top of your kidneys, make your stress hormones, right? Well, they also make hormones that balance your electrolytes and fluids. So she has a blood pressure problem. This started happening because she had blood pressure fluctuations because her electrolytes have been imbalanced for years and years and years and years, right? This gap, this 19.8, I think we said it was, doesn't just happen overnight. Okay. It happens so gradually and it takes years. So think about this. If you can't balance your electrolytes and your blood pressure can fluctuate, it can drop. And this can cause palpitations, right? This can cause lightheaded and dizziness. This can cause brain fog. She was having some brain fog as well. Like I said, the trouble concentrating. Oh my gosh. Now she knows why. And nobody could ever explain it. They just say, oh, you have like ADD or ADHD. That's just a diagnosis describing the symptom, and that's all it is. It's just a symptom. So she has this, trouble concentrating, and she literally had to retire because of this. Now, let's look at her alkaline phosphatase. This enzyme from the liver, from the bile duct system, should be between 70 and 100 optimally. So when I give you ranges like this, I'm referring to the optimal ranges that we should have. Okay, not these ranges over here, not these lab ranges over on the right, but we're referring to the optimal ranges that we've evaluated and studied in functional medicine. So this should be at least 70. This indicates that she has a zinc deficiency and is a marker for certain parasites because they steal that zinc. We see these enzymes AST and ALT that are over 19. Super optimal range for those is 10 to 19. When they're above that, not only are liver cells dying too fast, but they're becoming part of the liver fat. This is part of a fatty liver pattern. And she didn't even know about this, right? Doctors don't usually diagnose fatty liver based on labs because they're not looking for this. And simply because there's no treatment for it in medicine, all right? All they can really do is watch it progress until they, if it looks like you're going to outlive your liver, then you get on a liver transplant list. So this is where she's headed is, liver cirrhosis. And she has these enzymes, I'll point one out later on, that indicate this pattern. Now, this also, when this happens, this is a marker for insulin resistance. So we know she has a blood sugar pattern, a blood sugar problem, and this is part of that pattern. Okay. Now she has 2+ esterase, WBC esterase in her urine, which is often and trace blood, which is often due to yeast. All right, yeast in her kidneys and or bladder. Okay. Now, these are her genetics. Now, I'm not going to go through the calculator online, but I will say this. Um, these are this is the genetic test that we get to see how the body responds to biotoxins. So she is multi and mold susceptible, meaning she has the inability to clear out the toxins from mold and other biotoxins like bacterial toxins, parasite toxins, fish toxins, venoms. And when these toxins can't leave the body, they cause inflammation, right? They cause a lot of inflammation. They can cause disease, they can cause autoimmunity and cancers. So that's the significance of this test. Now, she has really low cholesterol. Now, you heard me tell you she's on a statin. So when you have low cholesterol, you are actually going to, the studies, the actual research and science shows that you will not live as long if you don't have enough cholesterol. It's because cholesterol is a basic building block for our bodies. And without it, we can't fight off inflammation. She's inflamed, and that's why she had high cholesterol. And so they gave her this statin. It's like taking the firefighters away from the scene of the fire. That's what this is like. Lowering the cholesterol is letting the fire burn. Okay. And it's also decreasing her hormone production. All right. Her DHEA production, her testosterone and estrogen production, possibly. And we'll look. Okay. Now, triglycerides. These are over 100. This is part of that fatty liver pattern, right? And furthermore, the statin is causing more problems with blood sugar and insulin resistance, driving that process. These drugs actually can push people into prediabetes and diabetes. All right, now let's look at her thyroid. So we see her TSH, and it's looking a little low. But we get the rest of these thyroid markers for a reason. We see the thyroxine at 11.2, the T4. We see T3 uptake is pretty good at 30, and the index is pretty good at 3.4. Remember, I said she has Hashimoto's. Her immune system is attacking her thyroid gland. So what's happening? Many times, Hashimoto's causes you to have normal thyroid markers, and it looks like everything's hunky-dory. She has all those thyroglobulin antibodies, and what happens is when the immune system attacks the thyroid, those thyroglobulins get destroyed. They're carrying hormone. It's like water balloons carrying water. They get popped, and the hormone releases, or the water releases from the water balloon. In other words, the hormone releases from the thyroglobulin and floods the system with hormone. And so she's got plenty of hormone. It makes things look normal. And let me show you her Free T4 is high at 1.93. This is high. And then she's got a really high reverse T3. So she's taking this levothyroxine, and that's T4 as well. That really doesn't contribute to this because the labs don't measure the synthetic. However, it will measure the reverse T3 that synthetic converts to. So it's converting to too much reverse T3. That's going to block T3. Her T3, I'm just going to jump down here, is 110. That's pretty normal. And then she has a free T3 of 3.1, which is also in the optimal range, anywhere from 2.8 to 3.4 or 5. So she is optimal. But again, it's because she's got this autoimmunity, these thyroglobulin antibodies, and the immune system, when it gets mad, pops those balloons, so to speak, spilling out the hormone into her system, and now things look good. And it's not like this every day, ladies. This will fluctuate day to day, sometimes week to week for sure, month to month. And how can you establish a consistent thyroid dose, a levothyroxine dose, if you're not looking at all of this and if you're not controlling the autoimmune triggers, which are causing things to fluctuate and be, causing her to be on this roller coaster with this? It's impossible. So the key is getting to the bottom of these triggers, right? And then we can customize a plan to help you um, take care of these triggers, okay, all at once. Get you into balance. All right. So she's got a glycomark test, which is a test for blood sugar variability, right? Now, when it's less than 20, she has variable blood sugar. All right. So she's at 14. This means that she's going to have higher highs and lower lows. This is going to cause food cravings, right? Sugar cravings, and ups and downs. It's going to cause weight gain because your brain doesn't like this low sugar. It's going to make sure you have fat as a backup. Okay. And she's got really low vitamin D, super low vitamin D. How is she going to prevent cancer? How is she going to regulate her immune system at all? Look, this is a trigger. This causes the immune system to attack when vitamin D is so very low, right? All right, so she's got low vitamin D, and this is really, really a problem. Always going to have trouble with weight gain, trouble losing weight if vitamin D is low. All right, her C-reactive protein. This is the cardiac C-reactive protein, which when this is over 3 indicates she's at high risk for a sudden cardiac event. I'm not talking about just developing cardiovascular disease, but literally having an event, right? So this is important. We got to get this under 1, close to 0 as we can, to get her out of that risk category. But this is important. And toxins cause this. I told you she is accumulating toxins because her genetics don't allow her to clear these toxins from her body. So they're going to cause all this inflammation, especially mold toxins. And when you have all these toxins present, they're going to really decrease your ability to make energy. So you're going to be tired. She's tired. She's, having trouble, like I said, concentrating. This is going to cause more anxiety, which she also deals with. Homocysteine is a bit high. I don't want it really above 5. This also increases risk for cardiovascular disease and neurodegenerative diseases like Alzheimer's and Parkinson's. Uric acid is also a marker for dysglycemia, part of that blood sugar problem. It's increased because of insulin resistance and because of too much fructose intake, probably too much fruit, maybe too many grains, and just sugars, right? So uric acid, ideally for women, should be below 4.5. And this causes arthritis. This causes pain. This causes kidney disease, right? Because the kidneys are the only way this is cleared from the body. All right, talked about those. Magnesium's a bit on the low side, I would say as well. It needs to be at least 2.3 to 2.5. Fibrinogen activity is another marker for systemic inflammation. So this needs to be, between, about 280 and 369, somewhere in there. When it's higher than this, and it's really high, hers is almost 500, this is a clotting factor, and she's at high risk for a blood clot or stroke. Insulin, fasting insulin, and she was fasting during these tests, should be less than 5. 2 to 5 is the optimal range. So if she's more than this, no wonder she's storing fat. No wonder she's having difficulty releasing that weight. And it's inflammatory, this insulin, causes that inflammation in the blood vessels that is evident by the CRP that we just looked at. Okay. All right, so that's the blood work, and I'm going to show you saliva. So hormones, let me blow that up a bit. So her hormones, again, I said that, look, her DHEA was a bit on the low side. Testosterone is going to be low. Estradiol's okay. You see the range here, 2 to 6. So that's okay. But the problem is all the stress that she has been under in her life caused her to produce a lot of cortisol. And the more cortisol you make, the less progesterone you make. And this should be 20 times what estradiol is to be balanced. 20 times. All right. So 80. So she's estrogen dominant. And this leads to weight gain, and it leads to mood swings and poor motivation. If you remember me saying that she was poorly motivated. And low testosterone isn't going to allow her to maintain her muscle mass, and it's going to, she's going to have low libido and certainly fatigue, because women need testosterone for energy too. And these high FSH and LH hormones, this is pretty common during menopause, where the pituitary is still really trying. So she's kind of in this transition where her pituitary is trying to tell her ovaries what to do, but are they going to listen? No, not going to listen too well, because they're not able to help her anymore. All right. Now she is positive for a dairy sensitivity, and she's positive for gluten sensitivity. So she is super sensitive to these. These will certainly cause the immune system to attack the thyroid and other areas of the body, right? So we talk a lot about this in the master class. I will give you all the reasons why these are so terrible, but yeah, stay tuned for that. All right, now her cortisol. If we look at her, I mean, obviously you can see things are off, right? Now, 37 is what it is in the morning, so it's way off the chart here, and goes down to normal by noon. Then it goes up higher again at 4 p.m. and then still is high by midnight. Look, she's stressed out. This cortisol uh, is definitely going to trigger the immune system. It's going to cause weight gain, especially around the midsection, and that is so difficult to lose, even with exercise. So you really won't ever, she won't ever lose it unless she gets things under control. Now, the scary thing about this rhythm is that you see how it dips down and then it goes back up. Well, this abnormal rhythm is the first sign of Alzheimer's disease, right? So the fog she's dealing with, the concentration issues, this is going to lead to further cognitive decline, possibly leading to, Alzheimer's disease or some kind of dementia. Insulin resistance is the number one cause of that. All right. Furthermore, she's not going to sleep well. And anyone who doesn't sleep well, and you heard me tell you that she doesn't sleep well, this is also the biggest risk factor for developing Alzheimer's disease and dementia. So super important that we check this so we find out, because we can help her with this stuff. All right. Okay, so there you have it. I wanted to share this case study because this lady was very similar to many of you. She felt terrible. She has all these symptoms that most of you have, and yet she kept going to her doctors, even a naturopath, I believe, and they were running her labs, and they told her that everything looked fine. She couldn't lose weight. She was tired all the time, and making plans was hard because she could rarely trust in her body to be able to keep them. How many of you deal with that? So the key takeaways from tonight: are you your own advocate? Right? Were this lady's doctors, were they checking her adrenals? Were they checking her for fatty liver? You know, how her inflammatory markers? How long has this Hashimoto's immune issue been going on? She had to take responsibility and get the right test when she had an opportunity to do so. She took responsibility. The word responsibility means the ability to respond, right? So it means that if you're not making progress, okay, if you still have symptoms and you're suffering, you have to respond. You have to do something different because when we don't, you know, and we don't like our day to day, it just becomes the same thing over and over, day to day, week to week. Tomorrow becomes the same thing as the next, and the next day, and the next day after that. Weeks turn into weeks, and that turn into months, and then years. And many of you have been dealing with these symptoms for decades. So I certainly encourage you to start becoming your own advocates, right? Like reaching out, asking for those blood tests, asking questions. You see something as high, you're asking those questions about what's going on with this. Because things are not just out of lab range for no reason. They truly mean something. And I do need to mention that I know the frustration that most of you have is that you have to ask for additional testing from your doctors. You're trying to get some answers, but insurance doesn't cover it. And this is nuts. I think you need to understand that the insurance's job is to make money for their shareholders and to make a profit. It costs them money to run these labs. That's it. So doctors don't want to run the tests that don't change the treatment because when they look in their toolbox and they have these thyroid hormones, they see, what they're giving you is always thyroid hormones. I mean, running all these other tests and even testing for these antibodies to see if you have Hashimoto's, which is the number one cause of low thyroid, it doesn't change the treatment, right? So the insurance deems it unnecessary, right? And so you have to realize that you're not going to run all these extra tests because you're in this drug therapy model. And if there's not a drug, then it's not necessary. But in this functional medicine model, we're looking through functional medicine lenses. There's a lot of things we can do. Okay. So we need to find this information. All right. Now, Medicare, even their guidelines say that if a treatment is to reverse a disease process or improve your quality of life, it's not medically necessary. It actually says that. So this is a sick care model. It's not a health care model, right? If you want to be healthy, you got to stay out of the sick care, right? Okay. Healthcare is preventing disease. Okay. It's reversing disease. It's putting you into an optimal state of function. All right. The other thing I want you to take away from tonight is I hope you have some restored hope and that you're not going to give up because there are answers. And if you have a symptom, there's an imbalance. You have to figure out what it is, and then that'll help you figure out what the solution is. All right. Now, next week in the masterclass, we're going to go deeper into these concepts and really understand what they mean. Okay. Because tonight I really didn't have a lot of time to go into all of it, but we're going to go into the secrets of why you can't lose weight, why you're so tired. What are some of those mental blocks that we carry around that we don't even realize we're carrying around and, that make us, if we do lose weight, we gain it back. Or if we just can't lose weight at all, keeps us stuck. So we're going to talk about some of the more in-depth concepts and more case studies so that you can understand what is going on underneath the surface. All right. So make sure that you join me and all these other ladies next week, all next week, Monday through Friday. You don't want to miss it. And oh, I love to see so many people post their success stories. Most of them are patients and they're doing, they're going through the program and they're really tackling their root causes. But some of them are not my patients. And they've only been, they've only attended the master class and they've implemented what they've learned from it. And some of these women are losing weight and their energy is improving. Joints are less painful and their lives are really turning around. So make sure you attend the master class because you're going to get so much information and attend live for sure. Make arrangements, any arrangements that you need to make that happen. Okay, and show up to session 1 and receive my free Thanksgiving recipe guide so that you can plan on an awesome meal. All right, one last thing. If you're new to the group and have questions at all, confused maybe about how to attend, make sure that you reach out to Nikki. She is your masterclass concierge. All right. If you know how to DM, you can DM her or you can text her at 208-842-4466. 208-842-4466. And she'll help you out. So if you have any questions or if you have any trouble, send her a message. She'll help you out with whatever you need. All right. So mark your calendars for the masterclass next week, the 20th through the 24th, and really probably through the 26th, because there will always there will be bonus videos and extra content. So each night, 7 p.m. Mountain, 8 Central, 9 Eastern, 6 Pacific. And if you're not registered for the class, Nikki will put it in the comment section, right? It's held right here in this Facebook page. The link to register, you want to register so that you can get the information that you need via email and texts and so forth. So you don't want to miss out on those. All right. And I'll take a couple of questions. Now, I know we've been here a bit, but you're probably beat and ready to go to bed, you East Coast ladies. But let me get to the questions. All right. How can we get these tests? I have my most recent labs. Can I send them and pay to be evaluated? Well, I guarantee that you don't have all these labs. You didn't get all these tests, and all of these markers are extremely important. And so I definitely want you want to attend the master class because I'll teach you all about these labs and how to get them, and so that's how you should do it. The next question is what stops the body from its ability to remove toxins? Literally genetics. Okay. Um, I will teach you about that. There's these genes, much like those of you who have figured out that you have the the MTHFR mutation where you can't activate your B vitamins, much like that, there are these genes that cause you to be unable to clear these toxins out. Okay. Let's see. How do we change the negative levels? I mean, that's a pretty general question. Um, First of all, you just have to know what they are, and then you have to have someone who can help you through this, someone who's knowledgeable, who can guide you through with the right treatment protocols and the right lifestyle, helping you make the right changes in your lifestyle and diet. And I teach you all about that in the masterclass. So again, you don't want to miss it if you really want the answer to that question. But there is no one answer for how to change the negative levels. You have to have the right treatment for sure. What is the root cause of her Hashimoto's from these labs? The labs don't necessarily tell me the root causes of Hashimoto's. We just know that she has Hashimoto's, so we know she has an autoimmune disease, and we know that we have to take a different approach with the autoimmune disease, right? And that approach is finding her triggers. That's what we can get from the tests. We know her triggers, and that's how that information is helpful. There are multiple causes of Hashimoto's. I did a Wellness Wednesday on this some time back, and I probably will need to do it again. But some of the major causes for Hashimoto's are environmental toxins, right? Infections, uh, and even heavy metals, right? There's a lot of things that can cause Hashimoto's. So there's there are certainly some things that you can start to clean up, but once you have Hashimoto's, you have it, and it just needs to go into remission. Okay. But I explain this in so much more detail in the masterclass next week. Don't miss it. I'll leave all of you with that tonight. So hang in there, and I'll see you back here in the group on Monday for the masterclass. Good night, everyone, and thanks for joining me. Take care.